Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. You know, the holiday season is once again upon us. It's just around the corner. And while it's an exciting time for many of us, for people living with overactive bladder, it can be a lot of stress and anxiety about visiting family and friends, traveling, and even avoiding certain holiday meals that may irritate the bladder. Well, if you're living with overactive bladder and this sounds familiar to you, short of canceling your plans, what do you do? Well, here with some tips to help manage this common condition is nurse practitioner specializing in urology and spokesperson for Urovant Sciences. Welcome back, Diane Newman. Thank you for returning.
Thanks, Neil, for having me.
Well, for our listeners who may not be familiar with you as a contributor, give us a bit of your professional background.
Well, I'm a nurse practitioner, and I've been practicing since 1986 in the area of what we call lower urinary tract dysfunction. So I see patients, men and women, with urinary incontinence, overactive bladder, or OAB, and any other problem, like pelvic problem, we call it. And I do what I call non-surgical treatment. So I do behavioral treatments we'll talk about in a few minutes for overactive bladder, as well as medication prescribing.
The holidays and overactive bladder. What have you found to be some of the most common complaints?
Well, what patients complain to me about is symptoms of urgency, which is a strong, intense desire to go to the bathroom that they can't control, frequency, which is going to the bathroom more often, more than 8 times in a day. And a lot of them have incontinence or leakage episodes, and this usually occurs after urgency. And, you know, Neil, like you said, it's more common than you think. It occurs in 1 out of 10 Americans, and that's over 30 million people have the problem. And what we find is that it's so embarrassing, people do not seek treatment, and many people think it's a normal part of aging.
So what causes it, and are men more affected than women or vice versa?
Well, we see men and women. We tend to see women who have urinary symptoms of urgency, frequency, and incontinence. Men, we tend to see urgency and frequency, but they may also have incontinence. Mm-hmm. And overactive bladder is caused by the bladder muscle contracting involuntarily, which means that it contracts sometimes when you're not aware of it or expected to contract, and it can cause urgency, frequency, and like I said, you can even have some leakage.
And that's not necessarily based on age. It could be an injury or an illness. Is that correct?
Yes. It's not necessarily because you're getting older. Some women think it's because they're female, and they think it occurs with every woman. What's interesting thing about it is people think that they're alone, they're embarrassed, so they don't talk to friends, they don't talk to family members, and they really don't even talk to their doctor, who they may see on a yearly basis, or another healthcare provider. But you're right, it is very common. There are other conditions that can cause overactive bladder. We do see it with diabetes. We also see it with any neurologic problem, such as, say, Parkinson's or MS. But really, we see it occur in men and women who have no other problems. It's just something that happens. And there are several things that, can trigger it. We call certain things such as diet.
Now, that's an interesting one. We're talking about the bladder, not the gut. How can what you eat contribute to overactive bladder?
Yeah, Neil, that's true. I mean, there's things that you can drink that can actually trigger overactive bladder symptoms. We see it with, say, beverages that have caffeine. Caffeine is what we call a natural diuretic, which means that it causes the kidneys to make more urine, and that can lead to more urine in your bladder, causing overactivity. It irritates the bladder. We also see it with spicy foods that can also do it. So what I tell people to do is an elimination diet. And what that means is you keep a record of maybe what you're drinking, eating, and see if possibly as 3 cups of coffee maybe in the morning is triggering overactive bladder symptoms during the morning hours. If you cut back, will your symptoms improve? So sometimes it's dietary reasons why you may have it.
Are there other techniques other than diet that you can use to help manage some of the symptoms?
Well, a lot of people think that it's, if I drink, I'm going to have to go to the bathroom, or it's going to cause symptoms of OAB. But really, drinking too little or too much is not good. If you restrict your fluid intake, it can cause dehydration, which is not good, but it also concentrates your urine, which can irritate the bladder muscle, causing urgency, frequency, symptoms of overactive bladder. One thing that you can do now that we're in the holiday season and you may be traveling is that what you may want to do is really drink normally, drink what recommendations for someone with your weight. Don't dehydrate yourself. Don't restrict your fluids. But maybe if you're traveling by car, cut back on what you're drinking 2 to 4 hours before you're leaving, say. Or if you're going on an airplane and don't really want to use the bathroom on the plane, then cut back maybe a couple hours before you get on the plane. So you can modulate what we call your fluid intake throughout the day. If you're getting up at night because of overactive bladder, you're getting up too frequently, cut back on what you drink after dinner. So there's things that you can do as far as within your diet.
Anything else that you'd like to add for our listeners?
Yes. You do want to, there's other, medications. And today I'm partnering with Urovant Sciences because they have a prescription medication called Gemtesa Vibagram, which is 75 milligrams. It's a once-a-day pill. You can take it with a glass of water, with or without food. You can also crush it, say, in applesauce and take it with fluid. It has no significant impact on blood pressure, and it has been shown to be effective for overactive bladder symptoms. Now, all medications have side effects. Those side effects that we see with this medication include headache, common cold symptoms, diarrhea, nausea, upper respiratory or urinary tract infections. Talk to your doctor or healthcare provider to see if this is right for you.
Now, is this approved for all ages?
This medication is approved for adults. So, men and women of all adult ages can take the medication. I hope your listeners know and really kind of get the message here that if you have this problem, seek help. The research in this area shows that less than half of people with overactive bladder live with the problem, don't talk to people, don't seek out help. And I hope the message that comes across here is that there are treatments for you. There's solutions for your overactive bladder. So please seek help. Talk to your healthcare provider, and also go to gemtesa.com as there's more information there for you.
Diane, always a pleasure. Thank you so much for returning here on the Health Professional Radio.
Listen, thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Diane Newman. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.